Okay, good afternoon. Like Brooke said, my name is Rachel Navarro. I am an exercise physiologist with a master's in science, and I have been with Methodist Cardiac Rehab for over a year now, but previously I was here for 10 years when I first got out of my master's program. So I'm going to tell you a little bit about what we do in cardiac rehab here at Methodist Hospital. So our cardiopulmonary rehabilitation department is an integral part of the Heart and Vascular Institute of the Cardiac Service Line. Our standards of care are based on the Joint Commission, which we just had here at our hospital in the last couple of weeks, and I am proud to say that we passed with flying colors. Cardiac rehabilitation accreditation. We set our standards through our performance improvement, Methodist Hospital policies and procedures, the American Heart Association, the American College of Cardiology, and the organization American Association of Cardiovascular and Pulmonary Rehabilitation is what we are accredited with or by. So our locations are Phase 1 is in the hospital at South Lake and North Lake campus. Our Phase 2 and Phase 3 exercise monitored cardiopulmonary rehab is at Care First at 753 East 81st Place in Maryville, Indiana. So criteria for cardiac rehab, whether it be Phase 1, 2, or 3, it requires a physician's order. The major diagnosis that we get that is covered by insurance is coronary artery bypass graft surgery, myocardial infarctions, stable angina, which is chest pain, angioplasties, congestive heart failure, and chronic obstructive pulmonary disease. Like I said, most of these insurances will cover Phase 1 and 2 with these types of diagnosis. Phase 3 is not covered by insurance, and it is a monthly out-of-pocket fee that is billed through the hospital. So when we have patients come into cardiac rehab, we have them first go through an orientation, and some of the assessments that we get to set their exercise programs is through pre-assessments consisting of 6-minute walk test for endurance, hand grip test for upper body strength, and body composition where we take their weight, their height, and their percent of body fat. Phase 2 is a supervised program consisting of telemetry EKG monitoring while exercising for 36 one-hour sessions. We also monitor their diabetic glucose levels, blood pressure, and exercise intensity while they are on the monitor. Once they get done with Phase 2, they graduate into a Phase 3 program, which is an exercise maintenance program, still monitoring blood pressures, heart rates, and rhythms. I feel that people stay in our program after they've done with Phase 2 just because they feel more secure exercising in our program, because if there's any type of cardiac issue that might come up, we can get in touch with their doctors right away. So I think they feel just more secure, they have better support versus going to a public gym. So the exercise equipment that we have at our facility are ellipticals, treadmills, stationary bicycles, recumbent cross trainers, which they use your upper body and your lower body to maneuver, upper body ergometer, which is basically like an arm crank with handles that you push forward, or you can crank it back to increase your endurance, your upper body muscular endurance. We also have weighted pulleys and resistance weights. Other services that we provide are education lectures and handouts that are given by our nurses, exercise physiologists, and registered dietitian. We also provide counseling and supportive services on anxiety and depression and other issues that are given by the staff in combination with resourcing internal hospital departments. So if there's like a support group that we have at the hospital, we can get them the information that they need, or like social service departments, they also can help us with special needs as well. So we have a variety of clinical team members, which consist of our supervisor, Jerry Janda. We have registered nurses. We have American College Sports Medicine certified clinical exercise physiologists, registered dietitians, and certified or registered respiratory therapists. We all have certain credentials that we have to have accreditation as well. So we have basic life CPR certification. The nurses also have advanced cardiac life support certifications. So the benefit of coming to exercise and cardiac rehab is going to help you reduce the development of atherosclerosis, which is hardening of the arteries, decreases total cholesterol and your bad cholesterol, which is the LDLs, can reduce body fat and increase your metabolism to maintain your weight or to lose weight or body fat, decreases your chances of disturbance in your heart rhythm, can also help control blood glucose levels and decrease your hemoglobin A1C, which is a 3-month-long period of how you are controlling your glucose levels. It helps reduce stress, anxiety, and depression as well. Other benefits of cardiac rehab through participation can reduce risk of any type of death or future cardiac events. It helps reduces hospital readmissions. It can also improve your functional capacity, improve your quality of life, and medication adherence. Also, consistent attendance helps develop long-lasting supportive relationships with other patients and staff members. I feel that there's a sense of community throughout all of our classes here at Cardiac Rehab. There's care and compassion for one another because each one of them has been through some type of cardiac event or situation, and they like to tell their story about what they've gone through so they make the others feel comfortable and like they're not alone. So one of our goals here at Cardiac Rehab at Methodist Hospital is to increase functional capacity, which we can measure by a 6-minute walk test with distance in feet, pre and post program. And our goal is to increase your distance by 200 feet or more from pre to post program. We also want to improve strength in our patients, and that's measured by our hand grip test in pounds per square inch, again with pre versus post program. Another one of our goals is to complete all the allotted sessions that is governed by what type of cardiac event they've had or maybe their insurances. But if we can get every one of our patients to complete all of their sessions, we know that we've done a good job. We also would like to encourage all of our patients to exercise 150 minutes per week through class or home exercise. The American Heart Association recommends 150 minutes per week to have a healthy heart. So our results over the past 3 years is the distance of the 6-minute walk test has increased on an average of 416.2 feet. This is an average increase of 43.7% from pre to post phase 2 program in our Methodist Cardiac Rehab program. In 2021, our program had a completion rate of 58.8%. So I hope all of you have learned a little about what we do here at Cardiac Rehab at Methodist Hospital, and that we want you to also know that we take your heart seriously. So I want to thank everyone that's come out to listen to my lecture, and if there's any questions, I'll be happy to answer.
Okay, are there any questions? Okay, that about wraps up our Zoom. Thank you so much, Rachel, for taking the time to present.
Thank you, Brooke.
All righty, bye-bye.
Bye.